Hi everyone, my name is Christina Figueroa and this is my interprofessional project. An overview of lead-acid batteries and its associated health risk. Lead is a toxic metal whose widespread use causes extensive environmental contamination and health problems in many parts of the world. With exposure accounting for almost 1% of the global burden of disease, with the highest burden in developmental regions, measures were put into place by the CDC and the World Health Organization at national and international levels in order to reduce and control lead use and prevent human exposure, in particular for children. This serious burden of intoxication still occurs from different sources, including lead-acid batteries, which pose a major health and environmental challenge, with approximately 86% of the total global consumption of lead being from production of motorized vehicles. Lead-acid batteries compose of two main elements, sulfuric acid and lead. If improperly discarded, it can cause a high amount of fumes into the air, in addition contamination of solid and groundwaters. Since sulfuric acid is highly corrosive, and lead being linked to health effects in humans, particularly in children, as high level of lead can affect multiple body systems, including neurological, hematological, cardiovascular, gastrointestinal, and renal system. This valuable commodity for many people in the developmental world makes recyclable lead a priority. Designing a green and sustainable battery system approach as a mean to the conventional remains relevant. I seek the suggestion of three professionals who have provided their viewpoint and suggestions towards alternative. Michael Moreno, who is a regional manager for global mobile communication, suggesting having a registered business partnership with the informal recyclers to create an eco-friendly recycling program that will ensure that all materials are processed sustainably. He stated that by using advanced processes of fully equipped and regulated facilities that have the necessary environmental and occupational monitoring, engineer control, trained staff, and facilities of protective equipment will allow for recovery and turnaround on high-quality lead to be utilized in new batteries and industrial applications. For example, he said it will streamline products that can offer stable and competitive pricing, more efficient operations, and meet or exceed regulatory, health, and satisfactory implementations that can benefit both the company and the informal recyclers. Another suggestion comes from Michaela Tabbing, a children and youth advocate, who suggests a collaborative effort for policy implementation, since there are few regulations and enforcement mechanisms to ensure safe, environmentally sound practices in these industries. She states that to best address this issue, we must engage social, economic, and cultural environment at a national, state, and local level, and where efforts from the nation's leaders should be more involved than just the traditional sectors. The governmental public health agencies and the healthcare delivery system should collaborate in creating a monitoring system to trace high level of lead toxicity in the blood in children. Furthermore, efforts of the public health system should be also supported by political will, which comes from elected officials who commit resources and influence based on evidence, and by healthy public policies, which all come from governmental agencies that consider health effects in developmental, agriculture, education, commerce, labor, transportation, foreign policies. The third suggested alternative comes from Rosemary Gonzalez, a real estate investor who proposes to create a waste management system that offers a reliable and cost-effective method, such as a drum management service. She stated that this will allow for special industrial hazardous waste to be arranged for proper treatment and/or disposal of the content while maintaining compliance with all local, state, and federal regulations. In addition, once these drums are received, they will be further inspected and tested under the protocols of the CDC Waste Analysis Plan. It will also allow for consolidation, as it will be shipped for further processing using other treatment technologies. She stated that fundings of these disposal and transfer facility handling of the liquid and solid will be provided by the Automotive and Industrial Division as an incentive, for it will be part of tax break. Interviewing these three professionals, which are highly qualified in their given careers, and in taking their suggestion as an alternative option for mitigating lead acid battery and reducing lead poisoning from informal battery recycling activity, have posed viable solutions to the issue. For Michael, some pros of his suggestion is having the business directly working with the informal recyclers, which will allow continuous income. Some negative things I thought that I could see resulting from it is recyclers might not be able to supply the demands. In terms of Michaela's suggestion, a pro that I found was having a collaborative effort between the healthcare system and the community workers can help mitigate and educate about the risks of the lead acid battery, which can help minimize exposure. But with that, implementation of policies for more sustainable outlook might require bigger financial outlets, which it goes beyond profitable revenues. And finally, with the suggestion from Rosemary with the waste management technology approach, I think that one would be with utilizing containers, drum containers, can allow us to consolidate, treat, and dispose of the waste might be a much easier approach to apply as it is cost efficient and easier to access. But nonetheless, we also have the negative and where automotive and industrial sectors might not want to pay for the transport or disposal of it. Nonetheless, these are three approaches that I found that were very helpful in reducing lead poisoning for informal battery recycling activities. And as an optional outlet, I think we should consider it.